You wake up with a scratchy throat. No pharmacy, no doctor, no pill. You are a prehistoric human, and your body is losing a battle you don't understand. What do? For 99% of human history, there were no hospitals, no antibiotics, no anesthesia, no prescriptions. And yet, we are still here, 8 billion humans, which means our ancestors survived infections, open fractures, complicated childbirths, tooth abscesses, without anything we consider essential today. And the question nobody asks is, how? The first medicine. Let's start with something that shouldn't exist. In 1957, in the Shanidar Cave in northern Iraq, archaeologists unearthed a Neanderthal skeleton, 46,000 years old. The man died at an advanced age for the time, about 45. Nothing extraordinary, but here's what is extraordinary. His right arm was atrophied, completely. He was missing a hand, amputated or lost years before he died. He was blind in one eye, deaf in one ear, and he walked with a limp so severe he couldn't run. Do the math. A man who couldn't hunt, couldn't defend himself, couldn't even flee a predator. In a world where every day is a struggle for survival, this man should have died in weeks, but he didn't. He survived for years, maybe decades. This means one thing: someone cared for him. Someone brought him food. Someone cleaned his wounds. Someone protected him from predators. Not for a day. Not for a week. For years. And this brings us to a fundamental truth. The first medicine of humanity wasn't a plant. It was each other. The living pharmacy compassion doesn't cure an infection, though, so our ancestors developed something else. A pharmacy hidden in plants, fungi, and tree bark. And we have the most concrete proof possible. 1991, Italian Alps. Hikers find a body frozen in ice, Ötzi, the Iceman, dead 5,300 years. In his gear, researchers find 2 pieces of fungus, birch polypore, a fungus that contains potent antibacterial and anti-inflammatory compounds. He wasn't eating them. He was carrying them, like a portable first aid kit. Ötzi also had 61 tattoos, lines and crosses, placed exactly on the acupuncture points we use today to treat arthritis and lower back pain. He suffered from arthritis. His tattoos were his treatment. 5,300 years before the first medical school. Impossible surgery. And now the part that is hardest to believe. 7,000 years ago, somewhere in Europe, a human lies down. Someone takes a flint tool and drills a hole in their skull, alive, without anesthesia. You think it's a death sentence? That's what everyone thinks. But archaeologists have analyzed hundreds of tree-panned skulls. Europe, Africa, South America. Here's what they found. The edges of the holes are smooth, rounded. The bone grew back. The patient survived, not days, years. In parts of pre-Columbian Peru, analyses show a survival rate over 80%. Skull surgeries drilled by hand with stone tools. 8 out of 10 patients made it. What they got wrong? Let's be honest. Our ancestors were not medical geniuses, far from it. For millennia, they healed by intuition. The Ebers Papyrus recommends a mixture of crocodile dung and honey for certain infections. The ancient Egyptians mummified their dead with surgical precision, but believed the heart did the thinking and the brain was useless. Ancient Greeks practiced bloodletting, removing blood to rebalance the humors. This practice survived until the 19th century. It killed more people than it cured. George Washington died from bloodletting. He was drained of 40% of his blood in 12 hours to treat a sore throat. What animals taught us? How did they know which plants to use? Part of the answer is in Uganda, Kibale Forest, with chimpanzees. Primatologists observed strange behavior. Chimpanzees slowly chewing the leaves of a plant called Trichilia rubescens. They don't swallow them, they suck on them, then spit them out. The plant has no nutritional value. Scientists analyzed the leaves. They contain potent anti-malarial compounds. The chimps were treating their own malaria, without knowing what malaria is, without knowing what a parasite is. They just learned that chewing these leaves made the sick feeling go away. This behavior has a name: zoopharmacognosy, animal self-medication. It exists in dozens of species. Elephants eating bentonite clay, a natural antibacterial. Bears rubbing insecticidal plants on their fur. Dogs eating grass to induce vomiting. Amazonian parrots ingesting kaolin clay to neutralize toxins from the fruit they eat. The three weapons. So, how did prehistoric humans heal without doctors? They had three weapons, and modern medicine is currently rediscovering all three. Weapon 1, community, a social immune system. If you get sick in a band of 30 hunter-gatherers, there is no bureaucracy to decide to help you. There are 29 people who have known you since birth. Your mother, your brother, your cousin. Your survival is theirs. Weapon 2, 300,000 years of trial and error. Every toxic plant was identified by a death. Every effective remedy was passed down orally, from mother to daughter, from healer to healer, for 10,000 generations. Weapon 3, the body itself. Before we invented antihistamines, the body knew how to trigger inflammation to isolate an infection. Before we invented sutures, the skin knew how to seal shut. Before we invented the placebo, the brain knew that believing in your cure accelerates it. The aspirin you take when your head hurts? That's willow bark, 10,000 years late. The hospital you go to when you're sick? It's the Shanidar Cave, with walls, beds, and people who went to medical school. But the principle is exactly the same: humans taking care of other humans. Modern doctors aren't the first healers in history. They are the last in a line that started long before we had a word for medicine. We haven't stopped being the species that heals. We've just forgotten how long we've been doing it.